with Dr. Costis of the State University of New York in Brooklyn and CureEveryone.org. And having reviewed our recent research and investigative report on chelators, what is your feedback and message to the rest of the world as far as the article itself and what say you?
Okay. Chelation therapy is still appears to be still very new in the medical community. It's been, even though it's been available for some years, I believe that in order to get a better understanding of how it works, that more research has to go into the area to try to get an understanding of how this works. And right now, the medication is being used off-label by a lot of people that are practicing non-traditional forms of medicine. There have been claims that people have gotten better from the use of therapy. However, the medical community at this particular point in time hasn't quite got on board with it yet. And that's just because it needs to undergo further clinical trials with humans. Better data needs to be collected, and then we can get a better sense of what how this medication is going to benefit us down the road.
And in synergy with that, basically every article that we cite as far as reference, the scientific community states that they don't really know how the chelating technology is working. But the benefit is far beyond the removing of the heavy metals. It's actually triggering cell death in cancer cells and viral cells, all the way up the line to AIDS. You want to comment on that?
I mean, once again, it sounds very interesting and very promising. However, once again, right now the chelators are only indicated for heavy metal toxicity. And once again, in order to say, with a certain degree of certainty that these medications can definitely be used for the treatment of cancer, I've seen in some studies that they have been used. However, the outcomes have been, somewhat questionable. So, with that in mind, once again, I just think that there just needs to be a lot more research into it so that we can learn a little bit more about it, learn how it works, and learn how the medication is really going to help people. I mean, in the scientific community, when we put forth a hypothesis, we undergo a series of steps and processes, and we expect a certain outcome. So, we really need to go through this process, very meticulously so that, we can, offer the best possible care. So with that in mind, like I said, I'm always, in favor of anything that can help the medical community as well as, the patient population. So, if there's something out there that just needs to be researched, then let's, get on board with that.
Okay, so, and that's the whole goal. Put some focus on this, and let's try to find out how it's potentially working, and let's draw attention to this potentially very positive outcome for patients, doctors alike. And thank you.